Hey there. A lot gets said about type 2 diabetes education, and probably not enough is being said about type 1. Any endocrinologist will end up seeing quite a few type 1 diabetes patients with type 1 diabetes in their lifetime. And for those of you who have been diagnosed with type 1, you or your parents will probably remember the day that you found out about this. It was an emotionally charged situation. You were probably not well and your sugars were very, very high. It came as a big shock to see how high your blood sugars were. And at that point, you were told that you need insulin to survive, and it was true. It was a life-saving hormone and life-saving medication for you. And it was programmed in your mind from that moment that my sugar is high and I need insulin to bring it down. And that's correct. Insulin is a life-saving as well as a life-threatening hormone in some cases. So we have to be very careful and understand that you need to coordinate with your doctor to get on the right dose of insulin. What unfortunately happens a lot of times is insulin becomes the hammer, and so for any situation of a high blood sugar, you think that I have to bring this high blood sugar down by hammering with more insulin. If it's high, I just need more insulin. If it's high, I just need more insulin. And there's a risk in that. Without education about insulin, without understanding what's a quick-acting insulin, what's a long-acting insulin, when to use which insulin, sometimes patients are left confused and they mismanage, not because they want to. Nobody wants to be sick and have unstable sugars, but because of a lack of knowledge. Maybe it's a lack of knowledge in the doctor themselves. So yeah, you should not be on pre-mixed insulin. You should be on either a combination of separate long-acting basal insulin and separate short-acting bolus insulin, or taking short-acting insulin through a pump. But you cannot be in the dark about how to use insulin. And the problem is, if all we tell you is insulin brings your blood sugar down, then maybe you're not being told to pay attention to the quality of food, the type of food, and you may be eating carbs and saying, well, as many carbs as I eat, if I know that my body needs more insulin for this food, I'll just take more insulin. And sometimes kids actually look forward to the accidental insulin overdose so that they can then go and have a chocolate because somewhere we told them they cannot have that. It's not all or none. It's about learning how to balance out your carbohydrates. Of course, learning carbohydrate counting. But just because you're counting, doesn't mean that getting away with eating junk and high carbs is going to be the answer, because as many junk foods you eat and high carb foods you eat, that much more insulin is going in, and guess what? You still have a body that's pretty much the same as everybody else. If someone with type 1 falls off a bicycle and scrapes their knees, they're probably going to have a little bit of blood. Most of us have, 2 eyes, 2 ears. We're all built the same in many ways. So the type 1 piece of it doesn't protect you from getting too much insulin, which then becomes insulin resistance, and you start getting a type 2 situation. The other problem comes if you've been told by your healthcare provider that you need to eat all day, you need to keep eating, you need to not miss meals, you need to carry snacks. That probably means that they've given you too much insulin, because if your insulin dose is right, it should be quite safe for you to have a slight delay here and there. There are some exceptions to that which you'll have to discuss with your doctor, but by and large, if you miss a meal and you're going into a very low sugar, that means you're probably getting too much insulin and you need to meet your doctor to reduce that dose or adjust the dose. Because if you keep eating all day, then again you're in the situation of gaining weight. So remember when you were first diagnosed, the problem was your sugar was too high. So if you're getting a problem of too low, that's too much insulin. Your sugar was high when you didn't have any insulin. If when you're not eating your sugar was low, that's too much insulin. So the solution for that is not to keep telling you to eat all day. The solution for that is to readjust the insulin dose and educate you about what types of foods will keep your sugar stable if there's a delay in the meal. The other thing is that if with type 1 you don't know about the other ways to bring insulin down, what are those? Exercise, a low carbohydrate approach, stress management, and fixing sleep. I see so many patients where the sugar is high because they've not been exercising, or it's gone low because they didn't know how to adjust the insulin for the exercise. I've seen patients whose sugar goes high when they're very upset, and it happens to anybody. It's just that in type 1 you see it. Okay, it happens to all of us, that there's a stress response, and the stress hormones will raise your blood sugar in type 1 especially more than usual. So learning to meditate, learning to have a stress management technique. There are so many times where patients have come and said, you need to give me more insulin, and I'm like, no, I know my insulin settings are correct for you, because on these days your sugar was completely stable and it's the same body, and on this day there's something exceptionally different. Was it a stress at home or at work? And then they're like, yeah, I was upset about something. So I'm not going to give you more insulin. The treatment should be to teach you how to manage stress. And then guess what? When you start breaking through those vicious cycles, when you start reducing your carbs, when you start learning stress management techniques and adding exercise, when you fix your sleep, then your insulin doses actually come down. It's not just an upward hill where anybody with type 1 has to keep having increasing doses of insulin. That's a sign that you're bringing them into the world of type 2, which is not good, because then you'll find that the same amount of units of insulin is not giving you the same result that it used to, and then you have to get impatient because all you know is insulin brings my sugar down, and you start hammering with more insulin, and boom, then your sugar will crash. Then you'll have to pick it back up with something, carbohydrates, and now you're going into a roller coaster. Don't let anyone ever tell you that type 1 diabetes is brittle. There's no such thing as brittle type 1 diabetes. The only time I've seen that is when the patient and the doctor together have not been able to figure out other ways of bringing blood sugar down, and when you overuse insulin is when you get all this turbulence. Okay, so again, then you'll find that your insulin doses come down when you use the other things: sleep, stress, nutrition, exercise. Type 1 diabetes patients can also have sleep apnea. Type 1 diabetes patients can also suffer from high insulin requirements if they watch TVs and screens till late in the night. That's not only something left for people without diabetes. So everybody is exposed to the same lifestyle challenges these days. The exposure to processed food, stressful work environments, difficulties in the personal life, all of that affects type 1 as well. So please focus on all these other aspects so that you and your doctor can figure out ways to reduce your insulin requirement, okay? That's a safer way to get your blood sugars more stable. Take care, guys.